being a part of digital health and technological advancement is going to be a way in which we can really solidify our profession's future and really diversify our profession as well. So one way in which digital health can hopefully advance a practitioner's kind of day-to-day is just by reducing some of that administrative burden. And then when we get deeper into that, it can help us to be a bigger part of this healthcare system, because really we are the primary healthcare providers for eye care in this country.
Welcome to The Focused View, the podcast for eye care professionals across Australia. Brought to you by Opticare. In each episode, we bring together leading eye care, optical and business professionals to share valuable insights, practical tips, and the latest trends shaping the optical business landscape. I'm your host, Michael Nasser, and together we'll explore innovative strategies for practice growth, patient care, and business success in the eye care industry. Whether you're starting your career, managing a practice, or just looking to stay ahead of the field, The Focused View is your source for inspiration and knowledge.
Nicola, welcome to the show.
Oh, thanks so much, Michael. Lovely to be here.
Yeah, really happy to have you and really excited to talk about today's topic. So I guess before we get into it, can you tell us a little bit more about your journey into optometry?
Yeah, sure. I've been an optometrist for almost 20 years now, which is pretty scary. And I feel like I have grown a little bored or disenchanted a few times with what I've been doing. And then every time I've tried something new and I've just completely fallen in love with this profession all over again. I graduated from QUT and I wanted nothing more than to live by the beach. So I took my first job in Newcastle and I had a really amazing mentor there in my first boss in a little independent practice. And I've had really great colleagues and mentors ever since in what I've done in optometry. And so I really wish the same for young optoms today. I've worked for different ophthalmologists and in laser clinics, and I've worked for the Aboriginal Torres Strait Islander Clinic and helped students, supervise students there. And now I'm working in an independent practice and also for Optometry Australia.
Yeah, we're definitely going to touch on your work with Optometry Australia. Now that you've raised it, what led you to work with Optometry Australia? And I guess, what are you doing at Optometry Australia?
Yeah, so I have two main sort of areas of work for Optometry Australia, and one is evolving scope of practice, which is a really big area that I'm quite passionate about, and the other is digital health. And what led me to work for OA was probably through the evolving scope of practice research that I did for them through the Look Scholarship and different roles that I'd had on some of their committees since. And so they invited me to work for them in the evolving scope portfolio. And I guess that digital health, even though it sounds like something that's quite a step aside from that, is quite strongly integrated with that. Because if we look at how optometry is going to advance into the future, I'm really hoping that our scope will advance. But along with that, we need to keep up with technological advancements and we need to be really integrated in the healthcare system overall.
Yeah, and I can totally see how those two intertwine with regards to what you're looking at. For today's episode, we're really going to focus in and hone in on the digital health component of what you're working on, because it's a term that's becoming increasingly important in the healthcare sector more broadly. But what does digital health mean to you, and how do you see it impacting optometry as it stands?
Yeah, that's a good question. I mean, from the outside, digital health kind of seems a little bit confusing, right? Like before I started this position, I guess I found it a little bit of a labyrinth. And in its most basic terms, I guess digital health is us just using technology to enable healthcare. But there are so many different facets of it. And I guess what I found refreshing when I started this job is that it really can be categorized into different important things that really need to happen. And also that being a part of digital health and being a part of technological advancement is going to be a way in which we can really solidify our profession's future and really diversify our profession as well. I guess the main thing that probably digital health means to me is a way to improve patient outcomes. Like as a practitioner, I'm just always wanting to improve patient outcomes and improve what job I do by each patient I see. Even though it's not something you'd think of straight away, digital health is an empowering way to improve patient outcomes if you use it correctly. And for the profession, I think it's just another pathway in which we can further our profession.
Yeah, and it seems to be it's gaining traction. It seems to be the future. And today we definitely want to break down what that future may look like. From your perspective, how does digital health benefit? I mean, because you mentioned that there is patient outcomes that are super important to you, and as it should be, I guess, from that point of view. But how do you see it actually benefiting optometry practices and patients?
Well, I think basically let's bring it to a relatable level to practitioners first, because, I'm a practitioner first and foremost. And really, sometimes in your day as a practitioner, your interactions with patients and just your pure workload with patients can be so overwhelming. And then the administrative burden on top of that can really feel like quite a heavy load sometimes. And so one way in which digital health can hopefully advance a practitioner's kind of day-to-day is just by reducing some of that administrative burden. And then when we get deeper into that, it can help us to be a bigger part of this healthcare system, because really we are the primary healthcare providers for eye care in this country. And as a whole, the healthcare system is really heading into this kind of digital roadmap for the future, where we're looking at a very interoperable healthcare system. So the government has a big plan for that. So those are kind of two parts of it, like just on a basic level, reducing administrative burden, and then secondary to that, becoming a part of this interoperable healthcare system. And then there are all the other things that can benefit patients and practices in terms of new technologies that emerge, AI, and different things like that.
And can you speak to some of the examples of how optometry is integrating with these digital health technologies today? And I guess if you see what you see in the future in some capacity?
Yeah, sure. I guess one thing that really drew me to digital health in the first place was this concept that through really exciting things like using AI and retinal biomarkers, we can look into whether people might have some form of systemic or neurological disease and help with the early detection and refer for best practice management of those things. But on a more day-to-day level, I mean, optometrists have always been amazing adopters of technology. We've used for many years now pretty advanced instrumentation with built-in normative data. And so some forms of AI are actually just those algorithms becoming more advanced. And optometrists are currently using those, and they're going to become more advanced with time. On a daily basis, we use software systems in practice, most of us, and that sounds ridiculous, but there are some allied health professions out there that are still a little bit behind with that. But our applications need to continue to forge ahead with time and meet the needs of an integrated system. Some practitioners are starting to do things for administrative burden, like with the use of AI digital scribes, and this sort of thing is pretty exciting for communication with the patient. But I'd urge those practitioners to just look up the guidance from APRA and RACGP on the use of digital scribes. And then we're pretty open to the ways in which patients want to take control of their own vision through things like tech-enabled eyewear and self-monitoring tools.
You've mentioned all these tools that are some examples with regards to how optometry is integrating with digital health. I guess, but a term that you've used a few times that we want to touch on is emerging technologies. And I guess that is integrated to digital health. But how do you see emerging technologies from a broader concept, roll out in the future of optometry? And is there anything specific that we should be keeping an eye on?
Well, it's a really tricky one, because the thing about emerging technologies is they're just accelerating at such a great pace. There's such a buzz around them. And yet, even for myself, I'm really trying to keep abreast of the advances in these areas. And yet, sometimes, I guess, because of the commercial benefits behind new technologies emerging, you don't hear about them until they actually hit the market. But I think that what optometrists need to know is to be able to understand the science behind what they're using and the way in which they're using it and their responsibility in regards to that. So what I mean by that is that optometrists are starting to incorporate AI into their practice. So they need to understand the algorithm behind the AI that they're using, and if there's any bias in the information that it's delivering. So these practice management systems really allow us to do so much. At the front of house, they're really well integrated and they make a patient journey pretty seamless for us. But then there are some things where if we're stepping up into this new healthcare ecosystem, we need to be able to do things like e-prescribing. And we need to be able to refer more easily and seamlessly and receive information back from other healthcare professionals more seamlessly and easily. things that optometrists should be aware of are actually things going on in the government space in digital health. So the government is really keen to bring about this kind of, I keep saying this integrated or interoperable health system, and people might kind of think, oh, what's she actually meaning by that?
Can you expand on that?
Yeah, so the government a couple of years ago released this digital health roadmap, and their plan in that is based around what they call a health information exchange. Now, what they're hoping for here is that at each point in the patient journey, their data can be shared amongst relevant professionals in real time. So the way that that translates in the story that the government's telling is, for example, somebody has called an ambulance at their home and data from their smartwatch will be sent ahead of time to the ambulance driver. Then the stats that will be received on the ambulance will be sent to the hospital ahead of time, and that will, affect their triaging and so on and so forth. But when we look at that from an optometry point of view, of course, what comes to mind most is our co-management of chronic diseases. And we're quite involved in chronic disease management. We have quite an important role in that. And so it's very important moving forward that we are able to receive information back from other practitioners who are involved in our patients' care, and that we can give them information in real time as well when it's needed. But also that information is useful in terms of evidence-based care.
And can you expand what that means, that the evidence-based care and the relationship between this particular ecosystem that the government is building?
Yeah, so if we're talking about diabetes, for example, then we know that there are certain risk factors in a patient with diabetes progressing on to have diabetic retinopathy. And those risk factors are things like different things that are found in their blood work, but also how long they've lived with the disease. And so if we're not receiving some of that data from the GP, then we're less equipped in our job. Of course, we can still assess the back of the eye and see when there's diabetic retinopathy, but we're still less equipped in our job to do the best job we can by the patient of informing them of what is needed for their health moving forward. Another good example is if we're going to become more involved in co-management of eye diseases with ophthalmologists, and especially in pre or post-operative care, then we need to be able to get information from ophthalmologists in especially the public health outpatients ophthalmology units, and to be able to access that information before the patient comes into us or when the patient's in with us, so that we can make the best judgment on their care.
And with regards to what you're explaining to me and what I'm translating that to what I see currently, and maybe I need to be corrected, but are we talking about something like this platform where optometry is going to be more plugged into? And if so, can you explain what that looks like and that potential integration? And I guess the significance of something like that happening?
Yeah, absolutely. So I think we all know that my health record has had a little bit of a rocky road in the past.
Mm-hmm.
And traditionally, I don't actually love the idea of everyone's healthcare data being indiscriminately shared, even amongst practitioners where it's not needed to be. And I think that that's what scared a lot of people about my health record and what caused some difficulty with the uptake in the past. But actually, for the health system to cope with the demands of the population and for the health system to be relevant to the world that we live in now, then something like this actually must be done. And if my health record, like the government is wishing for, is going to take this next step forward, then optometry really does have to be a part of that. So there's a refreshed agenda here. And the good thing about this is that in my work with this, in terms of trying to get optometry to be a part of my health record, which the Australian Digital Health Agency is really pushing for, what's reassuring in my involvement with this work is that the ethics of it's discussed really widely, and the objective is to empower the patient to have control over their healthcare. But basically what it will look like is that there's going to be a set of core data standards that are shared for different things. Like, so for example, we're coming up with a system for chronic disease management. What data needs to be shared between practitioners? Which practitioners need to see that data? And how will that affect the way that a patient is then triaged on to the next stage of their care?
So what we're saying here basically is that this data is being managed in a way that only the relevant practitioners that need to see it, or clinicians that need to see it, or as opposed to it being something that's publicly available to all practitioners and anyone can log in and see that? Or is that still something that's being developed and, I guess, worked out at the moment?
That's still being developed, but what the main messaging here is that the patient will be in control of who sees what data in their healthcare team.
Gotcha.
And so, the patient is really meant to be the captain of the team here, deciding which practitioner they want to see which information. And I think that's so important, because the basis behind this renewed initiative is that really there's a lot of burden in a patient retelling their story too many times, both for the patient and their feeling of the care that they're receiving, but also to the healthcare system. So the aim is in reducing that burden and also just creating a more free-flowing team where information is passed on as it should be, and there aren't gaps in a patient's healthcare needs.
Yeah, and we're definitely going to touch on the frustrations and the hesitancy to adopt technology, especially in this fashion, a little bit further on. And we'll definitely look at ways that you've seen, because I'm, again, correct me if I'm wrong, but when you started doing this, as you mentioned, you were a little bit hesitant, but as you now have seen it, I guess from the back end and the work that's being done, it's given you a lot of confidence with regards to what the system looks like. And I think relaying that message is pretty important. But if we sort of talk about the My Health record, how does that work for optometry? And again, it may already be working, I'm not too sure. But obviously we know with GPs and everything how it integrates. But for optometrists, does that mean that they get a login? Have they got a login? They get access to that information? Is that available now? Will that be available shortly, or is it still indefinite? Mm-hmm. What does that look like, I guess, on the ground in the industry as of now?
Well, currently optometrists can access the My Health record. To access the My Health record, you do have to go through a little bit of a process in that you have to have your HPI, which most optometrists should know. And then you do have to have a HPIO, which is to do with the organisation you're working for. That takes a little bit more work. So that's all through PRODA. And then you can access the My Health record. The difficulty with all of it is that we can't upload to the My Health record. And we also can't have ease of access. So as an optometrist, when you're chatting with your patient and you're on your software system that you're using, you're already putting data into that into that software system, and that distracts from the consultation with the patient. But then on top of that, it's very difficult to then open up a browser window, go into My Health record and try and find the information you want in there. So the goal is eventually to make that a seamless process and to have My Health record integrated with the software systems that we're using every day.
Understood. And you did touch on prescribing too. And another term that you used was a digital health agency. Is that the body that's, I guess, managing all of this? And can you speak to how that My Health record accessibility and also then the e-prescribing, how that all relates, and I guess the importance of software in all of that?
Yeah, that's a really good question. So the Australian Digital Health Agency are a government-funded agency that are in charge of delivering this digital health roadmap. And they're quite invested in bringing allied health along for the journey. So we've been working quite closely with them at Optometry Australia. And they are trying to release initiatives for software vendors to integrate with My Health record and e-prescribing. E-prescribing is similar to My Health record in that it needs this kind of a bridge between the software that we're using and the government kind of system that needs to be used for e-prescribing that we currently don't have access to in most optometry programs. And so that can be a little bit frustrating at times because we know that there just needs to be a bridge between these gaps, and yet sometimes that's a difficult thing to come by.
Yeah, and it's a little bit of like, in theory, we can see what's happening and I guess we can see the benefit of it. We also can identify and we'll speak further about the frustrations and the hesitancy towards it. But at the same time, there needs to be a practicality component to say, well, that's all really great, but on a day-to-day basis in the consultation room, how is this actually evolving and what does it actually look like? And I feel like there's a little bit of work to be done there. Again, we can touch on that a little bit later. One of the other projects that you're working on is the data terminology in healthcare in this instance. Can you explain what data terminology is and why it's essential for optometry's digital health integration?
Yeah, so at OA, like I just said, we work with different organisations and government bodies to kind of advance optometry in different ways. And one of the big bodies of work that we've been doing lately is alongside the Digital Health Agency and the Allied Health Professions of Australia, and a program called the Sparked Collaborative, which is driven by CSIRO. And this is to do with, enabling real-time health information to be shared. and across the healthcare system. And so what we're doing here is we're coming up with a set of terminology that will act almost like a language to translate between different systems. So this is going to be a language that's used for better recording and sharing of healthcare data. As a kind of an easier way to understand what I've been doing on that lately is I've been defining all of the diseases and conditions that we diagnose in optometry. I've been, basically listing all of those and comparing them to research terms and having, experts give feedback on whether those terms are correct, and just everyday practitioners to input their opinion on those terms. And also things like the procedures that we perform in optometry. And all of that goes into a database which will become part of the Australian core data set.
Is this an international initiative or is it mainly in Australia?
Oh, this is happening internationally as well. Yep. The Sparked team are working with international colleagues to make sure that we're kind of in step with them. There's no point in redoing each other's work, but healthcare systems internationally are moving in this way, in which, there's going to be greater sharing of information between different practitioners. And so to do that, there needs to be a common language.
Yeah. So if I'm to piece the puzzle sort of as we're speaking, because we are speaking about a whole heap of different things and tying it all together, would it be fair to say, and please expand or correct me if I'm wrong in any way, this data terminology obviously is about creating a library or a glossary of terms that is communally accepted, that we can, as an industry, and optometrists in particular, can refer to, and other healthcare professionals. This information will live on, I guess, My Health Record in some way, shape or form. Mm-hmm. And it's this that will enable the benefits of digital technology, with this information all being, I guess, uploaded in a way that can be understood by everyone and anyone in a uniform manner. And then the benefits, obviously, of that are various, as we've sort of touched on. Is that, roughly speaking, sort of the things that are evolving in this space?
That's right. And it's just that it will more easily translate between different platforms. So if we're taking, data that we're inputting, and that's got to be then translated into, say, for example, a hospital system's electronic record platform, then that it creates the bridge over which to do that. It's also important because if we correctly and safely use data about patients' health, and this is a tricky kind of a concept, but then we can improve patient outcomes by doing that. And so I think that this is also one of the government's aims overall.
Yeah. And can you shed some examples of where you could see that really benefiting? I guess from a practical point of view, where an optometrist will be like, yeah, this makes sense. I mean, I'm assuming co-management is a massive part of that. Are there any other examples that we could speak to with regards to, obvious or perhaps not so obvious benefits with regards to sharing this information and how it will enable the optometrists to integrate with other healthcare professionals?
I think that, when we think of co-management currently, we're conversing with GPs and ophthalmologists, a lot of us in primary practice, but we do also have a lot to do with other health professions like endocrinologists, rheumatologists, neurologists, but the allied health professions all coming along for this journey, and medical professions and specialists also coming along for this journey means that overall there's going to be a lot greater collaboration between a lot of different professions. I think that the more that we collaborate in the healthcare system, the greater our chances of really harnessing chances for optometry to expand into the future and to have more diversified roles in the future. So if we're looking at things like evolving our scope of practice, we really need to be able to communicate information about patients' health, and we need to be able to do things like, like we were saying before, e-prescribing. We need to be able to deliver scripts to patients in a seamless way. We need to be able to be on top of those changes to be at the top of our scope of practice as well.
And I feel like, optometry is just a form of healthcare, and as the industry is a whole. And so, there are so many relatable aspects of healthcare. And as you mentioned, optometrists will work with a various amount of healthcare professionals. So if we don't stay in line with them, then obviously we fall behind. And one way that I always sort of think about things is, okay, let's say we do it and there's the risk of obviously, or there's some risks and the benefits. I guess, what are the risks if we don't do it? Like, what would the industry look like if we don't adopt this?
Yeah, that's absolutely it. If we don't stay on top of these changes that are happening, then there are great risks in that. the government's quite clear about its agenda towards this digital future that it's envisaged. And one example of that, which is not relevant to our profession at the moment, but the government brought in legislation in the last few months that means that there is a mandatory sharing of information from radiology and from pathology, and that those practitioners have to share that patient information to be able to claim a Medicare benefit for that service. So we don't believe in that coming to optometry. There's so much data that we collect in optometry. There are just so many images and so much data that we collect. And not all of that is relevant to share with everyone. But it does show you that basically this is really important to the government, that this information is shared, and that really to be seen as a more integral and valuable part of the healthcare system, you need to be showing that you are able to be versatile and be agile in digital health as well.
Yeah. It's one of those things that are happening, and I guess we've just got to, go along with that, right? And I think it's to the benefit. And there are two things I want to focus on, I guess, at this stage, and we've touched on them throughout, but the first is frustration, and the second is, I guess, the fear of, digital health systems. But if we touch on the frustrations, and we've touched on it slightly already, but with regards to the uptake of this technology, generally it's slow in nature. And so a lot of things that we speak about, and especially when we hear about, AI and things like that, it means so much. But because of the slow pace of, the change in digital health, which is probably not a bad thing when you think about all the T's you've got to cross and the I's you've got to dot with regards to making sure everything's done in the proper way. What can be done for our industry or for these frustrations, especially for, say, independent optometry practices that perhaps are not always in tune with it as much as, say, maybe a corporate or where there's a lot, maybe more training or advice on these types of initiatives?
Independent optometrists are, they're pretty forward-thinking people overall. And I think that, what they can do is to take that fear that sometimes exists around advancement and change and to really turn that into a sense of empowerment. And what I mean by that is that if there is something that they feel is missing in their day-to-day practice, whether it just be something simple to do with their patient flow or their administrative burden, and they can see something that might improve that, to reach out to whoever they can to try and make that happen. So what I mean by that is if they feel like that, something could be improved about the software system that they're using, to just reach out to their software vendor and say, hey, it would make my life a lot easier if I could send an e-script to my patient, or if I could just view their My Health record or contribute to their My Health record more seamlessly. And there are other little things that they can do to be empowered. For example, if they're kind of wondering about AI and how they might use AI in their practice, like you say, there's kind of a lot of talk about this sort of stuff, but it's not in our everyday yet. But as they grasp new technologies at their practice, to make sure that they're looking into the information behind that and that they're looking into their responsibilities behind using that, and making sure that they're always that there is a person overseeing that information and checking that it's correct.
And I guess because it is quite slow natured, these changes don't happen overnight. Is there a time frame, we say the things that you're working on, as to where you see that evolving? Is this something that will see more prevalent with what we've discussed, say, in the next 3 years, 5 years, 10 years? Is there any sort of time frame with regards to this really advancing, and then the communication of all of this and how it's happening in the more mainstream where it is discussed more often?
I mean, I guess some things are really slow moving and other things are really rapid. Like the work on this Sparked collaborative has been really quite rapid. So that's quite encouraging to see. That's the work by CSIRO and all of the different health professions working on this data terminology. And so I think that we're going to see massive changes there over the next year or two.
Wow.
With the My Health record advancing, I think that that's probably got a midterm timeline of about 3 to 5 years until we're probably going to be involved in that. So really staying, but that could happen faster. So I think just staying on top of what's going on there. And then I think with emerging technologies, those things are changing, honestly, every single day. And so it's just good to kind of keep ahead of what's happening there.
And the emerging technologies, that's more of the enterprise side of the industry, because that will come via suppliers, via providers of either product or services that service the optical industry. Is that correct?
Yeah, absolutely. And through research as well. Like, part of my role is that we've got an advisory committee in digital health. And some of the practitioners on there are absolutely amazing with the backgrounds that they have, but some of the research that's being done in Australia into AI retinal biomarkers and things like this, we're really leading the way there.
Okay.
So sometimes it does come from a research background.
That would make total sense. So I feel, again, this is probably a generational type of question. I know that a younger demographic is a lot less fearful, rightly or wrongly, of data, the sharing of data and how much data is available online. I know obviously as generations get older, they're a little bit more hesitant. And knowing that our industry, obviously, and like most others, are dominated by people that are, I guess, more mature, for lack of a better term, there's a lot of fear about this and a lot of hesitancy with regards to the data being so publicly available. Can you speak to that fear? One way to think about that is the benefits you're getting out of it. But from your point of view, because you mentioned that you did sort of see that fear, or you had that fear initially, but now seeing what you've seen, how can we overcome this fear that is naturally, I guess, inherent in us with regards to the public sharing of our data over, digital health systems?
That's a really good question, because I think that it's good to have a level of fear and skepticism over this. And I have been very happy to see that a lot of the people who are in these meetings that I attend to discuss these matters do also share some level of fear over that.
Right.
So I guess that my reassurance there would be that the people that are working towards this are people like you and I, and also engaging with kind of people from the public. So there's public representation on these initiatives as well. And I guess my main thing that has kind of reduced that hesitancy of all of this data being shared is that the patient is in control of who sees it. And I think that that's, for me, that's really the crux, is that the patient is meant to be empowered in this health journey, and this sharing of information. What it can give us, in return, is more accessibility to healthcare, which is really needed. If used properly, less burnout for clinicians, which is really important. It can give us improved research outcomes and better health outcomes. And it can give us kind of healthcare that is in line with our day-to-day lives now. So what I mean by that is that, this is kind of mentioning something new as well, but some of the other government initiatives in this roadmap are things like when a patient goes online and performs sort of symptom checkers and things like that before they take themselves to a public hospital, and that has good and bad implications if it's not used in the right situation. But I guess that's the way of our world now. We all want an answer right here, right now. And I tend to be a bit more old school. I used to love the encyclopedia, but, I think that the healthcare system does have to change in line with what people are wanting and to keep up with the demand on it. And this is one way in which they can try and facilitate that.
Yeah, that makes sense. And I guess as we start to sort of summarize it all up, in your view, from what you see with everything that we've discussed, and again, everything that you've seen from the work that you've done in this space, what's the most exciting aspect of digital health, and what do optometrists have to look forward to?
As a practitioner, optometrists can look forward to ways in which they can practice to the best of their abilities by their patient, by kind of utilizing these technologies alongside their skills and abilities and their knowledge. And I think that that can be done in a few different ways. For a practitioner, it can also set them aside from others, by allowing them to kind of really embrace ways in which they can move forward their preferred areas of practice. And for the profession, I think that digital health can be a pathway forward for us to have diversified or advanced areas of practice. So I think there are some exciting implications there. And I think that, we don't know everything about healthcare. We don't know everything about disease. That doesn't apply just to optometry. That applies to all of healthcare. And I think that there are going to be things which emerge with technology, which really empower us as clinicians and empower patients to have better outcomes. And so I find that an exciting part of it, that we could better people's lives with it.
Yeah, I think a word that you've used a lot, and I love the word so much, it's probably one of my favorite words in the English language, is the word empower. And I feel like effectively what this is all about is, as you've said many times, empowering and giving people the option and allowing for the industry to improve and for our services to improve, all with the patient, I guess, at the center of it and ensuring that they get a better outcome. That seems to be, I guess, the take around. And we've got work around the frustrations and the hesitancies and the fears and learn more about this. And that's why, I've been so grateful for you to come and explain and talk to us about this, because we don't get to hear about this a lot of the time. And so, it's good to know what's happening behind the scenes with all this sort of stuff, because there is so much work happening. So I think it's really exciting. But for optometrists who might feel overwhelmed by this, or even curious and excited by this, anyone that wants to start integrating digital health into their practices today, what tips would you have for them and how would they go about it?
I think that information is always the key to embracing change. And there are some incredible education resources out there. Optometry Australia is dedicated to incorporating digital health into our programs for CPD. And so you'll find offerings on, AI and things like that. We've released a position statement on the use of artificial intelligence in optometry. And so I'd urge them to have a look at that. And also different resources which can be really handy. Like I mentioned before, the RACGP and APRA have guidance on digital scribes. But there are also really good resources from the Australian Digital Health Agency on more simple things like ensuring cybersecurity. And I think that for practitioners that have a level of hesitancy or are uncertain where to begin, and some of those tutorials would be a great place to start.
Yeah,
you'll find in a lot of different news articles that are released for optometrists or different industry papers that there are things about emerging technologies, and just instead of skipping over those articles to delve into them and think, how could this benefit my practice or my patients? And is this relevant to the area of practice that I want to step forward into? So I think optometrists, we learn a lot from talking to each other, and so I would say start those conversations with your colleagues, say, what are you doing to kind of integrate your practice more in digital health? And also, what new technologies are you embracing? And what do you think about the use of AI algorithms? And have those conversations amongst each other. And that's always an invaluable resource. But also, Optometry Australia are always here. And so for any inquiries about, these sorts of matters, then definitely give us a call and we can walk you through that.
Yeah, absolutely. And all the links to what you've just explained there will be in the show notes. So if people want to investigate or learn a little bit more, just check on the show notes and you'll see all those details to that information so you can learn more about it. But what I was going to say earlier, and I guess what really, and I was a bit passionate about it. So, that one question that you said, or one phrase which resonated with me was, what benefit will this bring my patient? And I feel like if you're learning about this technology to see how it can benefit your patient, and if that's the catalyst that you're using to drive you to learn more about this, I feel like you generally can't go wrong with that.
Yeah, I think if learning comes, learning usually comes from a good place, right? And I think that that's a very good place to come from with this sort of thing, is to think, how could I benefit my patient? How could I benefit my practice? How could I even benefit myself and my enjoyment of my profession? And I think that digital health might seem like a dark horse on that one, but that there are ways in which it can really open your mind to new ways of practice.
Yeah. And I think the difficulty with it seems to be something that's happening. And at the end of the day, if you are resistant to it, it's just a matter of time before it's going to become too big. It's just happening. And that's just the way of the world, I guess. And so embracing it and learning its benefit and understanding what you can do to ensure that it is a safe environment and you're getting most out of it, but you're also protecting your patients, I think is important. So there is a lot of due diligence that needs to be done. It's why, I'm very grateful again for you coming on board to having a chat about this, because I feel like it's conversations that, optoms and the industry should be having more of as it becomes more and more prevalent. So I guess on that note, Nicola, I really want to say thank you for your time and for your insights. If people want to reach out and get in touch with you, if they have any questions, what's the best way for them to do that?
They can definitely email me at Optometry Australia. We'll put my email in the link.
Yep. All right. Thanks so much for your time.
Oh, lovely to chat to you, Michael. Thanks so much.
Stay connected by subscribing to The Focused View and visiting our website www.thefocusedview.com.au for additional resources and episode summaries. We look forward to your company again in our next episode. Until then, keep focused. I'm Michael Nasser. Bye for now.